So right here, medial, little tiny bump right there. That is the trochlear fovea.
Okay.
Okay, so let me return.
And the orbital plate.
Orbital plate. So the floor, the orbital plate of the frontal bone. So the floor of the anterior cranial fossa is the same as the roof of the orbits.
Okay. Foramen magnum is the backbone.
Condyloid canal. It's right there. Flank. Internals. There.
That's the internal occipital
Protuberance.
So just this area?
The high point.
Oh, that's...
Yep,
okay.
this is also the general structure.
Okay.
And this point would be your external occipital protuberance.
Okay. And then
Internal occipital crest is this ridge of bone that separates the fossa for the cerebellum as well as for the occipital lobes.
okay. The external is out here already.
Yeah.
Okay. Oh, okay. Sagittal sulcus.
So separates your two parietals.
Okay.
I thought that was a sagittal suture.
Oh, sagittal sulcus, I'm sorry. This is the sagittal sulcus.
So the suture is outside, the sulcus is
Yeah,
inside.
so basically the sulcus runs right over the suture.
Okay, cool. Transverse sulcus.
Right here.
Okay. Occipital condyle. So these, right? Okay, and then jugular notch.
That's one you really don't need to know, but it's right here.
It's just a notch.
Yeah. I'm more worried about it, the jugular foramen, which is right in front of it.
Okay, that's the foramen. Okay, cool.
Hypoglossal canal. It's back here. There it is.
Oh, so it's back there? I thought you said it's underneath.
Yep.
Okay, I see.
So you can kind of see it right there.
Okay, that's hypoglossal canal.
So that's where cranial nerve 12 passes.
Cool.
The clivus, it's right here. That's slope. Clivus means slope.
And it's part of the occipital bone?
Yep.
Okay.
The basilar part of the occipital. That's where your pons rests. And so between the pons and the clivus is your basilar artery, hence the name basilar part of your occipital bone.
Okay. And then your superior sagittal sulcus.
It's the same thing as sagittal sulcus. So it's a structure right here. You can call it sagittal sulcus or superior sagittal sulcus. I like to call it this because the sinus that runs in that group is the superior sagittal sulcus sinus, excuse me.
Okay.
But if you call it sagittal sulcus, it's fine because it's sagittal.
Okay. The temporal bone, so your squamous is...
This is the squamous portion. Zygomatic process right here. So there's a suture right here. I don't know if you see the suture. So this is zygomatic bone. This is the zygomatic process of the squamous portion of the temporal bone. So this whole arch right here, this is the zygomatic arch.
The arch is
That's
formed
the-
by the process and the bones.
And the zygomatic arch is formed by the zygomatic process of the temporal bone and the zygomatic bone.
Okay, cool.
What's next?
Articular tubercle.
Articular tubercle. Don't need to know that one. I crossed that one off. Mandibular fossa. Right here.
Okay, so where the mandible sits.
Yep, so where the condylar process of the mandible rests. So that forms your TMJ joint, temporal mandibular. Temporal bone, mandibular mandible.
Cool. Alright. Petrous portion.
Groove for the superior petrosal. So that is in the petrous portion. Doesn't show it on this very well, but at the ridge, so this ridge right here, a bone, this is the petrous portion. And if you run your finger, there's like a little tiny groove. That groove is the groove for the superior petrosal. and it runs along, and it drains into the transverse sinus. Yeah, so superior pterosaur, superior pterosaur, superior pterosaur, transverse.
It'd be like this.
Right here. Right there. So that's where cranial nerves 7 and 8 leave the cranium.
Okay.
Carotid canal. Carotid canal is only going to be seen on the base of the skull, right there. So just medial to the styloid process. So it goes in right there. So it goes in, then it makes a bend medially. If I can grab it here. And that's where it exits. So it exits above the foramen lacerum. So when I pull that pipe cleaner out, you're going to see a hole. So if I go straight down and I pop it back over, it's coming out. That was the carotid canal where my index finger is. That is the foramen lacerum. Yeah. So that's where people get confused. It's like, how come I don't see a carotid canal up here? Because the carotid canal opens above foramen lacerum.
Okay. And then external auditory.
Right here. Ear hole. Right there. Styloid. Just looks like a stylus.
Okay.
Tympanomastoid. So fissure between the tympanic and the mastoid. It's right here. So this is the mastoid process. This is the tympanic portion. So that fissure between the two. And there's a division of the vagus nerve that passes through that fissure, which you don't need to know. Mastoid portion. Lesser wing of the sphenoid, optic canal. So this section right here, you may see it. There's a suture that runs right along there. So this whole section right here, that is lesser wing. So underneath, that's the optic canal.
Okay. What's a greater wing?
This whole structure right here. This is greater wing. This is greater wing. So see the suture? There's a suture.
Oh, I see.
There's a suture. This is temporal bone. This is temporal. Greater wing, lesser wing, body. What's next? Chiasmatic groove doesn't show very well, but sometimes there's a groove right in here. And so the optic nerve comes out and forms and goes into what we call a chiasm. And sometimes the chiasm will form a groove in the bone between the optic canals. Right here. That's where the chiasmatic groove would be. Anterior clinoid. These are the anterior clinoids. So these form the anterior-most portion of the sella turcica.
Do we go with the superior orbital fissure?
This is the superior orbital. Right there. So the superior orbital fissure is between the lesser and the greater wings of the sphenoid.
Where does it come out of?
Orbit. Just below the optic canal.
Okay.
Greater wing, foramen rotundum, right there. So just inferior to the superior orbital fissure. That's rotundum. So that's where 5 sub 2 exits the cranium. That's the maxillary. So that's a good question. So let's follow 5 sub 2. So we're going to put 5 sub through foramen rotundum. And we're going to end up, I don't know if you can see my pointer very well. Right there, see the end of it? There's that deep groove, that is the pterygopalatine fossa. And above it, this is where my finger is, that is the infratemporal. And then this area here is the temporal fossa. So what happens is, if I run my nerve through the infratemporal, or excuse me, the pterygopalatine, just give me a second here. If I can do it. It may not let me. It's a tight fit. go through. So what would happen is, I go through the pterygopalatine, it's going to come back into the orbit through this inferior orbital fissure. Okay. And then from there, what it does, it goes into a groove in the floor of the orbit, in the maxilla bone. There's a groove right here. That's the infraorbital groove. And then that nerve passes out onto the cheek through the infraorbital foramen.
Okay. Foramen ovale.
So foramen ovale, so oval shape, big foramen right there. That's ovale.
Okay.
So 5 sub 3 passes through ovale.
Can I ask a question?
Yeah.
Is there a particular name for this structure?
I've always called it the internal occipital crest, because you're this whole thing, because you're splitting. Always learned it as it's the crest that separates the fossa for the cerebellum and for the occipital lobes.
So because I refer to this as the crest, but then you refer to the whole thing as the
The
crest.
crest, and this bump is the internal occipital protuberance. Yeah. Alrighty. Where was I?
Foramen spinosum.
Okay, spinosum is just lateral and inferior to ovale, so it's right there, little tiny hole. So this is ovale, that's spinosum, and so that's where a blood vessel called the middle meningeal passes through.
Okay. So then you get to the body.
And the middle meningeal, that's the blood vessel that connects with that recurrent meningeal I was talking about earlier. It's a great shunt vessel in cases where your main artery to the eye, the ophthalmic, becomes blocked. Is blood can be shunted through that middle meningeal into the recurrent meningeal, back into the ophthalmic. So, what's the next one? I'm sorry. I got spinosum. Oh, so the body. So the body be the inside. So the body separates the left and right middle cranial fossa. So the carotid sulcus is this structure right here. It's that kind of that groove, because that's where your internal carotid is going to run. So they're just on the sides of the body.
Sides of it. Okay.
Sella turcica. So this is the sella turcica. So this is the anterior clino. So that's the anterior bedpost. This is the headboard structure right there. That's the tuberculum sellae. Has 2 little tiny bumps to it. So tubercle. This one's kind of broken off, but yeah, the posterior clinoids are very less similar to this. They have little points on them, and then that'd be the foot post. The footboard would be the dorsum sellae. This satellite portion, that is the hypophyseal fossa. So this whole structure is sella turcica.
Okay. Median and lateral.
So we gotta flip it over. So this is the inferior most portion of the, so like the legs of the bat, basically. So lateral pterygoid, medial pterygoid. Sphenoidal spine, it's this structure here, this small piece. I don't expect you to know that. Perpendicular plate. Easiest way to know, this structure right there. The midline of the ethmoid bone, that is the perpendicular plate. Forms the majority of the anterior portion of your bony portion of your anterior nasal septum.
Okay. The
Lamina orbit, it's just the part of the ethmoid bone that's part of your orbital, your orbit for the structure. Very thin structure, almost has a pale appearance because it has filled with air cells. So that's the lamina orbitalis of the ethmoid. Superior in middle. Now you're not going to see superiors because they're way up in the nasal cavity. So this is the middle. right there. That's the middle. And I'll just show you right now. This is the inferior nasal concha, which is not a part of the ethmoid. It's its own bone.
Oh, it's superior and middle is part of the ethmoid.
Yep.
And down here,
The inferior is its
by
own
itself.
bone. Yep. So but you're not going to see the superior because it's way up in the nasal cavity.
Crista Galli.
Crista galli. So
Spear.
this is the Crista galli. Yeah, the spear, exactly. Cribiform plate. It's the area around it with the Swiss cheese appearance. That's the cribiform plate. The holes is the olfactory foramen. So the olfactory bulbs sit on the cribiform plate like an onion, and then the little rootlets pass through the olfactory foramen. And
It's
are
about green onions, right?
yeah,
Because I was thinking about the.
I love green onions, so that's why I talk about onions a
I was
lot.
thinking about sweet onion. I'm like, how does that make sense? But now I get it.
Yeah, it's the little rootlets from the bulb that pass through the cribiform plate, and then they rest way superior in the nasal cavity.
Okay. And olfactory.
It's just the holes in the cribiform plate. That's where the nerves pass through.
Palatine.
Yeah. Yeah, you can mention it. Yeah, so question is, are skulls in the library? The answer is yes. So you can check out skulls for use in the library. Okay? That was easy. Okay. Let's see where we're at now. Palatine. So Palatine's a little tough to see on this because it's buried underneath. So this would be, so this small portion right here, so it forms the posterior portion of your hard palate. That is the crossbar of the goalpost. That would be the horizontal portion of the palatine. So the vertical portion passes up. So the vertical portion is actually under here. And they're a little easier to see on the exploded skeleton.
So it's like an upside down gold close.
Yeah, so it's like this. So the wall, the vertical portions form the posterior walls of our nasal cavity. The crossbar forms the palate. Okay.
Orbital process.
You're not going to see it. It's a little process on the top of the goalpost, like the flag of a goalpost you may see, and then on the orbital process is the orbital surface, which is a very small surface. It's way back here. It's a very small part of the floor of the orbit that the palatine serves. Very tiny.
Maxilla.
Maxilla, fossa for lacrimal sac, right here.
What is this? The inferior nasal.
This. That's the inferior nasal.
Oh, it says on its own bones.
Yep.
This is separate. Alveolar process.
The bone between the teeth. So you have alveolar processes on your mandible as well. Yeah, Nathan, question?
Oh, hey, yeah. Clivus. Okay, so how's that different from the basilar part of the occipital
It's
bone?
part, the clivus is part of the basilar part. So this whole structure is basilar, so the clivus is part of the basilar.
Got it.
You got it? All right. Okay.
For orbital groove.
It's right here. That's that groove where the infraorbital nerve passes through the inferior orbital fissure into the groove and then pops out the infraorbital foramen on the surface of the cheek. So it provides sensory innervation to your cheek area. So the infraorbital nerve that passes through there is a division of 5 sub 2, the maxillary nerve.
Okay. So you show us the fragments.
Yep, and that's right on the surface of the maxilla. So there's one there, one there.
Okay.
Zygomatic. This is the zygomatic. Nasal, 2 nasal bones. So the nasion is at the intersection between the 2 nasal bones and the frontal bone. So right there, that's the nasion. A vomer. This bone right here. That forms the posterior portion of the nasal septum. This is the vomer. Right there,
What's the upper portion of it?
that's the perpendicular plate of the ethmoid.
Okay, so that's right in front of it.
Yeah, so this is the perpendicular plate. Mandible. This is the body. This is the ramus. So where the ramus transitions into the body, this is the angle. This is the head. This little section that connects the head to the ramus is the neck. We have two processes. This is the condylar. So
Wait, condylar and head is what's the difference?
condylar process, the head is part of the condylar process. The head and neck make up the condylar process.
Okay.
So the condylar process fits into the mandibular fossa. It forms your TMJ joint.
Okay, that makes sense. And is this just a neck process of the mandible?
This is the coronoid.
Quarter.
So this is where your big muscle, the temporalis, inserts, and that allows the jaw to elevate. Mandibular notch, this is the notch. So between the coronoid and the condylar, this groove, that is the mandibular notch. Mandibular canal. So this is the foramen, it's in the ramus, mandibular foramen, and as we pass in there, it's a canal that runs along the ramus and the body.
So you point if you stick the
Yep.
pipe in
So if I was really good, I could run that all the way through and I would pop out there. That is the mental foramen.
Okay.
I don't know if it's on there or not. Yeah, the TMJ is just the condylar and the condylar process articulated with the mandibular fossa. Sutures. So coronal separates the two parietals from frontal. This is coronal, like a coronal plane. Sagittal. This is the sagittal. So this is in the sagittal plane, separates the two parietal bones. Squamous. It's this section, not this section, but this section, this arch-like suture that separates the squamous portion of the temporal bone from the parietal. That's squamous. Lambdoid.
Oh, lambda.
Yep. And then this structure, lambda shape, that's the lambda. And then this is the lambdoid or lambdoidal. It separates occipital from parietal.
So what is, you say it stops right here? What is this right here then?
This here is parietal mastoid. This little
This
section.
suture here?
This little, right there, right where my fingers are. That little section, that is parietal mastoid.
Okay.
But for lab, you don't need to know that. You just need to know the 5 major ones. Coronal, sagittal, 4. Coronal, sagittal, squamous or squamoso, lambdoidal, lambdoidal.
Okay.
Landmarks. So lambda basically is just the formation of the lambdoid and the sagittal sutures. So that intersection, it forms like a lambda shape. This is lambda. Pterion is at the intersection of the temporal, parietal, frontal, and sphenoid. So this is the sphenoid, this is the frontal, this is the parietal, this is the temporal. So this area right here, that's the thinnest area of the skull. That's the pterion. And it's thinner in some. If you look at the bone, look in some of the other skulls, it's very thin right here relative to like the frontal bone or the occipital bone. It's extremely thin. So that's why it's easy. If you want to fracture the skull, that's the easiest place to fracture. And the problem is right over the pterion is we have a groove for a artery, and that is the middle meningeal. Okay, bregma. So this is the bregma.
Right in the middle.
Yeah, right
Is
there.
that similar to
Bregma.
the glabella?
The what?
The glabella? Is that similar? Or
Oh, excuse me. I'm sorry. This is the glabella. I'm sorry. This is the glabella. I always get this. This is the bregma. The intersection of the sagittal and coronal. That's the bregma. I'm sorry. You're correct. So this is bregma. That's glabella. Intersection of frontal and the frontal nasal sutures and the two nasal sutures. That's nasion. Inion. It's the highest point of the external occipital protuberance. Vertex, highest point of the skull. Genion, tip of the mandible. We also call it the mentalis as well. And that's it.